Hi doctors, I hope that you missed me. My advice today is be alert, think about the issue of the station and try to find the missed pieces. Be clear and talk as simple as you can. And listen actively and attentively. And I will discuss what is active listening in this video shortly, inshallah. Let's start. Today, I'm going to talk about the 4th, 5th, 6th, and the 7th skill areas in the marking sheet, which are findings, issues, language, and listening. Let's dive into them. Findings. You could get a tick here if you don't identify abnormal findings or results or fail to recognize their implications. It means that you didn't identify or recognize significant findings in the history, in the examination, or in data interpretation. Let me clarify it more. Generally speaking, you could get this tick in this skill in examination or procedure stations, in SIMMAN stations, or the station that consists of test results or explaining an X-ray or ECG to the patient. Somebody might ask, when does that happen? Well, when you are in examination station and you examine the mannequin and you are unable to find the abnormal findings, so you will have this tick. Or when you have an abnormal test results in front of you and you can't reach the exact problem or how to interpret the results or what to say to the patient about the next step. In other words, you got lost. So you will have a tick in this skill area. Okay? So please try to practice more and more on examination stations, SIMMAN stations, and test results, because you will have all of them in your exam. Okay? Issues. You could get a tick here in two possibilities. The first one is if you don't recognize the issues or priorities in the consultation. For instance, talking about the specialist role and leaving your role in treatment, like in transient ischemic attack case. If you talk about the CT and the Doppler and the specialist job, and you leave aspirin and treatment of blood pressure, which is your job as an FY2. Stabilize the patient first, doctors. Okay? Yes, you can talk about the specialist job, but after mentioning your job first. Alright? The second possibility is if you don't recognize the key element of importance in the station. For example, giving health and lifestyle advice to an acutely ill patient, like in myocardial infarction, pneumonia, urinary stones with severe pain. The patient is in severe pain or feverish and systemically ill, and you are talking about, do you eat healthy? Do you smoke? Do you exercise? Or blah 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 blah. Do you think this is appropriate in this scenario? Obviously, it's neither appropriate nor safe. Did you get my point? Language. You could get a tick here in one of three possibilities. The first possibility, if you don't use language or explanations that are understandable to the patient, including not checking understanding. The second possibility is use medical jargons. The third one is if you speak too quickly for the patient to take in what you are saying. So please, doctors, speak simply, in good pace, give the information in chunks, and check understanding by saying, "Am I clear so far? Is that clear for you? Are we in the same page? How does that sound?" And these things. And don't use medical jargons, please. Talk as if you are talking to your old mom or dad. All right. Listening or active listening. Active listening is more than just paying attention to someone who is speaking. It's about listening with all of your senses, focusing on the verbal and non-verbal communication of the person who is speaking, and demonstrating that you are engaged with the conversation. What is the importance of active listening? Well, active listening is a vital skill that helps you to fully engage into a conversation and make people feel respected and appreciated. It's important because it demonstrates genuine interest and respect for their opinion instead of making them feel like they are not being heard. Others will also trust you more, and you will have much better relationships with your patients or your colleagues. How can you conduct active listening? Face the speaker, make an eye contact, show that you are paying attention by nod along, nodding your head, avoid interruptions, give verbal affirmations. To give verbal affirmations, to show that you understand what the speaker is telling you by saying things like, "Yes, I see, you are right." All of these allows the person talking know that you are following them and makes them feel more confident and at ease. Okay? Listen with empathy. So when you listen to the patient, try to reflect with empathy words or empathy phrases, and please show your sympathy in your body language, in your face expressions. Okay? So reflect on what they are saying by sympathy and empathy if the station needs that. Like if the patient says, "I have cancer and I'm taking chemotherapy for it, and I don't want to take this medication again." So please show your sympathy in your facial expressions and try to give some empathy words like, "It must be a tough time. I'm really sorry that you are going through this. It must be difficult. It is a challenging time." Okay? So try to use empathy words. Did you get my point, doctors? Ask for clarifications. Like if the patient says, it is affecting my work. So tell the patient or ask the patient, you just said the word work. Can you tell me more, or can you tell me how it is affecting your work? And in your management, address that, please, doctors. Okay? So by that, you are showing them that you are listening. I am actively listening. It is in my memory. I remembered them. Okay? The last thing is paraphrase what is said. Like sum up or summarize what are the findings, what are the positives in the history, and then give your diagnosis and your management based on these findings. Okay? I'll attach videos about active listening in the video description for more clarification. Okay? These are the QR codes for my groups, and I'll share the links of my groups as well in the video description. Please join us now. Thank you so much, doctors, for watching, and see you in the next video. Bye bye.